Hello, I'm Chris Sundberg. I'm Executive Director of Elder Voice Advocates, and I'm delighted to have with us today Dr. Alon Caspi, who is a PhD and a distinguished gerontologist, elder mistreatment researcher, and passionate advocate for elder care reform. As a board member of Elder Voice Advocates, Dr. Caspi brings decades of research expertise in elder abuse prevention, person-directed care, and dementia-related behaviors. His commitment to providing and improving the lives of older adults aligns with our mission to promote transparency and accountability in long-term care, making him a vital voice in advancing elder rights and protections. Dr. Caspi's overview of the ProPublica nursing home data will highlight why integrating this resource into elder care IQ is such an important enhancement, further empowering families, advocates, and lawmakers with vital insights to identify and address poor quality care providers. Elder Care IQ is your single trusted source for uncovering the truth about long-term care providers in Minnesota. By combining state investigation reports with the ProPublica's federal government data, this powerful screening tool offers unprecedented transparency. It empowers families, caregivers, and advocates with critical insights into abuse, neglect, and financial exploitation, helping them make informed decisions that prioritize safety and quality of care. With Elder Care IQ, navigating the complex landscape of long-term care has never been easier or more vital. At Elder Voice, we believe transparency is the foundation for accountability. With that, I'm going to turn it over to Dr. Caspi. Thank you.
Thank you, Chris, for this kind introduction and for hosting this webinar. We're going to share the screen now. Okay. So today we're going to talk about Nursing Home Inspect website, which was developed by ProPublica. The website contains investigation reports that were completed in nursing homes across the country and a series of other key pieces of information that could be useful for different groups, such as the public, applied researchers, media reporters, care advocacy organizations, and others. I prepared the content for this presentation, and then towards the end, we're going to have a segment where I'm going to walk you through the website and show you more hands-on some of the things you can do to find information that is of interest to you. So before I go into talking about the Nursing Home Inspect website, I want to point out that ProPublica put out an introductory webinar to the Nursing Home Inspect website in the summer of 2023, when they enhanced their search capabilities within their website. While the webinar was primarily geared towards journalists, it certainly could be very useful for others as well. And I included here the link to the webinar. While they were enhancing the search capabilities to detect those investigation reports in a more efficient way and faster, they also wrote an article with tips, a series of tips to make the best out of this very, very rich and powerful data set. And if you have questions about the Nursing Home Inspect, well, you can ask me, but if I don't know, then you can also ask Ruth Talbot from the ProPublica, who wrote this article. and whether you have comments, questions, concerns, or suggestions for improvement, because they're always on the lookout on how to improve their Nursing Home Inspect website. So I want to give a little bit of background about nursing homes for folks who are maybe not as familiar. There are approximately 1.2 million people living in over 15,000 nursing homes nationwide. When I use the acronym CMS, it stands for the Centers for Medicare and Medicaid Services, which is the federal agency overseeing care and safety in nursing homes nationwide. CMS contracts with state survey agencies. For example, in Minnesota, it would be the Minnesota Department of Health. So from here on, I'm going to use the acronym SSAs. So CMS contracts with the SSAs to conduct surveys within states. The SSAs conduct standard annual inspections and also what is called complaint investigations. Surveyors or investigators determine whether a nursing home meets what is called the requirements for participation in the Medicare and Medicaid program to receive funding from those programs. Now, when I use the term deficiency citation or FTAG, so these FTAGs are issued when a surveyor finds that the nursing home violated one or more nursing home regulations. And those inspection and investigation reports are posted on CMS Care Compare website. And I'm going to touch upon it briefly, but the focus today will be mainly on Nursing Home Inspect website. Now, how does it all tie together? Well, Nursing Home Inspect of ProPublica draws investigations from Care Compare. And it used to be called Nursing Home Compare. Now it's called Care Compare. Okay, kind of taking a step back, big picture, we advocates and researchers and professionals know that there's a long-standing challenge of accessing investigation reports in the assisted living sector, where nearly roughly 1 million people live. And also, there's a long-standing challenge with accessing subtypes of mistreatment in nursing homes. And I spoke extensively about it in a Grand Rounds presentation that I gave at UConn a couple of years ago. And I included here the link to the recording. Because there's such a gap of knowledge, many times we as advocates and researchers had to make FOIA requests, whether it's to a state agency such as Minnesota Department of Health or to CMS with FOIA requests to gain access to these data. The challenge is that it can take many months to receive it, and you don't always receive what you were hoping to receive. So that's a challenge for researchers and care advocacy organizations. Here are some examples of gaps in the data in nursing homes. So unfortunately, substantiation and issuance of citations for abuse are collapsed, are aggregated together with neglect. And so that's one challenge, because when you make a FOIA request and you say, give me all the neglect investigations nationwide or in this region, because they're collapsed into one FTAG, state survey deficiency citation, then they're unable to quickly compile the information and release it under the FOIA request. So that's a barrier. Same goes for theft of belongings, whether it's money, jewelry, is not separated. They are not separated from, I should have written here, from theft of opioid pain medications. And different types of accidents are not separated in the FTAG system when they have different causes. And so we want to be able to have that differentiation in the CMS FTAG system. So here are another example of a gap in data in nursing homes is the phenomenon of resident-to-resident incidents, which is often a subtype of neglect, especially in the context of residents with dementia. So again, it is collapsed under different forms of abuse or neglect. And so it is, when I actually made a FOIA request to CMS, they said, sorry, we can't release to you only resident incidents because it's all collapsed under different types of neglect and abuse. And so I published an article with 20 reasons why we need to bridge that gap. And 2 years later, the GAO urged CMS to do essentially the same. And unfortunately, 5 years later, they only implemented part of that GAO recommendation. That was a priority recommendation. And HHS, which oversees CMS, agreed with the recommendation. And we're still 5 years later, and it's only partially implemented. So a big barrier there. So I want to just point out some studies that I've done and projects that I've done using investigation reports. And just to highlight how important those investigation reports, and these are the summaries that the surveyor and the investigator at the state level write up when they issue a citation, and then they provide the evidence that allow them to make that substantiation and issuance of citation. So the first one we called Complaints Matter with my colleagues at Purdue University. We compared complaints and standard surveys in terms of severity across 6 different types of mistreatment. And we found that complaints consistently are cited at a higher scope and severity level compared to standard inspections nationwide, kind of highlighting the importance of complaints. I did a project examining 300 injurious and deadly neglect in assisted living and nursing homes in Minnesota. You can see the Elder Voice webinar in the link. Again, that was based on data practices requests to MDH. The first one, Complaints Matter, was based on a FOIA request to CMS. I did a small project on theft of money and jewelry in assisted living based on data practices requests to MDH. Theft of opioid pain medications based on 2 data practice requests, and our weekly monitoring of investigations as they are posted by MDH weekly. I did a study on residents' experience of fear of retaliation when they want to voice concerns and mistreatment. That was actually data from the Nursing Home Inspect. I'll get back to that in a minute, and it was funded by the Long-Term Care Community Coalition in New York City. And there's also a report called They Make You Pay that you can find online. And then I also did a smaller project, 50 investigations on staff fear of retaliation when they witnessed or become aware of abuse and neglect, but they're fearful of reporting it out of a concern about retaliation. Also, those investigations were retrieved from Nursing Home Inspect. Current projects and studies that I'm working on is social media abuse. By that, I mean when care staff take photos and videos of residents with demeaning and abusive content, and they post it to social media platforms, most commonly Snapchat. So you can see here a link to Elder Voice webinar that I gave on this issue, but we're now expanding the data set substantially with dozens more data elements to really delve to understand this phenomenon, how we can prevent it, and to hopefully publish the first study in the United States on this emerging threats on older adults. And I'm also starting to collaborate with Professor Pam Tister, who published numerous studies on sexual abuse of older adults in long-term care settings. We're going to focus on sexual resident incidents. It's in the planning phase. And this actually illustrates the power of Nursing Home Inspect, whereby she told me that many years ago, she had to go and change laws in her state to be able to access APS data on sexual abuse of older adults. And it took many, many months and a lot of time and effort to be able to access these data, when we now, with Nursing Home Inspect, and literally it's at the tip of our fingers, we can access it. And she was blown away when I actually walked her through Nursing Home Inspect. She said, "This is fantastic." And she immediately said she wants to collaborate with me, which I felt very honored, given her expertise in this area. And I highlighted residents' fear of retaliation with 1 asterisk and social media abuse project with 2 asterisks because the study on residents' fear of retaliation that I did was based on an investigation report that I retrieved from Nursing Home Inspect website before they went through the before they enhanced their search capabilities. And I had to go through 135 investigations one by one. Many of them could be many pages long, to identify those 100 ones for the study from 100 nursing homes from over 30 states. And then after they enhanced their search capabilities, I was able to find for the social media abuse study 100 investigations in substantially less time, substantially less time. And you'll see as I'll demonstrate it later. So as Chris mentioned at the outset, there's major issues with transparency, not only in the assisted living sector, but including in the nursing home sector. It's better, but there's some substantial gaps there as well. We could talk about lack of full information and disclosure of ownership, and also the financials. Where does the money go with third parties and real estate investment companies and private equity firms and all those tricks of the trade where the money disappears and then the nursing homes claim that they have razor thin margins of profits. And I'm not saying here that some nursing homes don't struggle financially when they're trying to do their best with their resources, but it is a big problem there. And we also talk a lot about, as advocates, about the difference between choice and informed choice. That's a big difference that we want to emphasize, that it has to be informed choice. So Senator Ron Wyden in 2007 in a congressional hearing asked the following question: why is it easier to shop for washing machines than it is to select a nursing home? And Katie Smith from the CEO of Leading Age said, there is nothing that nursing homes should not tell family members or potential residents. The question is, what do family members want to know? Well, they want to know a lot, but the industry consistently and systematically blocks a lot of those efforts to increase transparency in the nursing home sector. And I gave two examples of ownership and financial profit, etc. Some states pass laws to make sure that, say, 70% or whatever portion of their profits must go back to direct care, not to the pockets of owners and shareholders and third parties and you name it. In the assisted living sector, in a testimony by Robert Mollica, who was a senior program director of the National Academy for State Health Policy, he spoke about the decision to move to an assisted living. He described it as a life decision. This isn't buying a car. These are people's lives. And and a senator responded, it isn't buying a car, but you darn well kick the tires. And my impression is that the assisted living industry is flying under the radar without a black box. Approximately half of states do not post online mistreatment investigation reports in assisted living. And here are two examples. In New York, the health department does not post online completed investigation reports. And I wrote an article about it. And I even spoke with their senior attorney, and they said, we simply don't have the manpower to do it. So how do you provide resources for those health departments to do it? Because the public needs to know about those mistreatment violations. In contrast, Minnesota statute requires investigations to be public, but the Minnesota Department of Health, Office of Health Facility Complaints website is very difficult to navigate, and the investigations are buried in the website. And also, you can only retrieve one investigation at a time. And if your loved one needs to be discharged within 24 hours from a hospital into assisted living, you know, it could take many, many hours to understand how to navigate it and to paint a picture of a particular assisted living, which is why Elder Care IQ was created to bridge that gap. And in a couple of clicks, you can generate complete investigation reports at the level of the individual assisted living, nursing home, hospital, hospice settings, intermediate care facilities, and other care settings. So it's really innovative, and it actually won an award for that innovation. And I want to highlight Elder Care IQ and show you the homepage here. And big thanks to Scott Zerby, the IT brain behind IQ, that worked closely with Chris Sandberg, who's hosting this webinar, and the other board members who were supporting this innovation that's really cutting edge, and hopefully other states can consider adopting this platform. Of course, when only half the states post those investigations, then you first need to make sure that those investigations are posted online to be able to do that. And here is an example that this is one example of one nursing home in Minnesota. And the point of this screenshot that I put here is you can see the number of substantiated investigations and the unsubstantiated investigations, but I put it here to show that now, for the first time, Elder Care IQ is linked to ProPublica, and you can click on that, and that will open a window to an array of useful pieces of information for the public, families, and other groups. Now, kind of taking a step back, the primary focus of today's presentation is on nursing homes. The Nursing Home Inspect website does not focus on private pay only nursing homes. So it's only nursing homes that are under Medicare and Medicaid that receive a payment from Medicare and Medicaid services, or what is called CMS certified nursing homes. The focus today is not on assisted living residences. I pointed it out earlier, just kind of for a broad view of the long-term care industry as a whole and the gaps there. So potential users of Nursing Home Inspect include, as I mentioned, the general public and elders. Not just elders, could be a lot of younger adults with disabilities who live in nursing homes or consider living in a nursing home, and their families who are looking for a nursing home for a loved one. Applied researchers and media reporters, care advocacy organization, industry watchdog organizations, staff and administrators, and anyone who is looking to do a deeper dive in nursing homes. Now, this is a kind of a disclaimer whereby no one data point summarizes a nursing home. And not having a deficiency citation doesn't mean that the care is great. Think about, for example, nursing home with 10 unsubstantiated allegations versus a nursing home with none. Which one would you consider moving your loved one? So that means that there were at least 10 there were 10 complaints, possibly. And so complaints are also indicator of care. So let's make sure not to, the fact that there is no substantial investigation doesn't mean that the care is good. Serious neglect and abuse can take place even in 5-star nursing homes. And CMS rates nursing homes across America between 1 and 5 stars. 1 is the worst, and 5 stars is the best. However, a lot of neglect and abuse can occur in 5-star nursing homes. And there's also a lot of nursing homes game the rating system in different ways. And there's also, I should mention, special focus facilities and special focus facility candidates, which I'll talk about in a minute. So there's other pieces of information that a family needs to gather before making a decision. And the tool should not be the sole source about nursing homes and about whether to move a loved one to a particular nursing home. Now, CMS Care Compare website allows access to information about every CMS certified nursing home in America. And as I mentioned, they also have related to that what is called the 5-star quality rating system that I just described. And it's comprised of 3 components, 3 major components. And one is health inspections and the complaint investigations. The second is nursing home staffing level. And the third is quality measures. Today, we're only going to focus on component number 1, health inspections and complaint investigation that can be accessed on Nursing Home Inspect. And I highlighted the quality measures component because it's highly prone to manipulation by nursing homes because it is self-reported. The nursing home staffing level, it's much better since 2018 when CMS shifted towards payroll-based journal system reporting, but even that could be manipulated in the margins. But again, today we're going to focus mostly on health inspections and complaint investigations. But if you are interested in the Care Compare website, I wrote an extensive report which describes the good, the bad, and the ugly about the Care Compare website. And if you email me with the email at the first slide, I can send you the report. And some advocates say that the nursing home Care Compare website may give a false sense of security to the public. So we always have to be cautious when we are um, consulting with information on these websites. Now, Nursing Home Inspect ProPublica website was initially launched in 2012. Back then, it allowed a very basic search feature. In 2013, ProPublica substantially enhanced the search features. This is really groundbreaking, and I can't express the excitement about this change. It's not perfect, but it's a major improvement. It allows to search for all investigation reports at once. Search results includes brief summaries of the reports, which are easier to digest. Some reports could be dozens of pages, in fact, long. In fact, today I just saw a report with 78 pages long. So it gives you a brief summary so you can quickly detect whether this report is of interest. The website updates monthly to include new data and deficiencies. Now, each nursing home's website on Nursing Home Inspect includes a link to that nursing home's webpage on CMS Care Compare website. So I hope this is not too confusing, but I'm trying to show that those two different websites, but Nursing Home Inspect draws all the investigations from Nursing Home Compare. And a friendly warning, investigation reports will disappear from CMS Care Compare website after about 3 annual inspection cycles. Therefore, they will also not show any longer on Nursing Home Inspect website. So my advice to researchers and others, save those PDFs. Even if you're not a researcher, you should be mindful whether you're an elder abuse attorney and you found those investigations from 2.5 years ago, well, you come back 6 months later, it's gone. So be mindful of that. Okay, and we're going to show you the website itself later during this presentation, but on the landing page, I'm just going to share with you some of the types of information that you can find. You can get a national overview of mistreatments, subtypes of mistreatments, trends and violations, and common issues. You can have a state-by-state breakdown of serious deficiencies, fines, delayed inspections, which I'll define in a minute what it means. Most recent serious deficiencies, it actually could be flagged, filtered that way. And you can focus on one or more states or one county or more than one county. Now, I should mention that Nursing Home Inspect is not meant to conduct comparisons across states. And part of the reason has to do with the varying levels of quality of implementation of the quality of information of the federal regulation. So, and each state several agency across the country have different resources and capabilities to investigate complaints and to conduct surveys, as I will show in a minute. And so it might be very tempting to do that comparison, but I caution against it. You can perhaps do it at a crude level, as I'll show later on, but you have to be mindful of that. So the advanced search capabilities in Nursing Home Inspect and the filters that they provide now allow users to narrow a search by, you can use multiple keywords and combinations of keywords, such as with or and, as this example shows. And there is this idea of stemming that if you don't use quotation mark around the word that you're interested in, let's say pressure ulcers, if you don't use quotation marks around ulcer, then it will retrieve all variations of the form of the word. And here's an example. A search for the word choke without quotation marks will match chokes, choked, choking, etc. But if you're interested to retrieve investigation containing an exact term or phrase, you need to put it in quotation marks. And I'll show examples of that later. And I really want to point out the fact that searching information on Nursing Home Inspect, whether you're a researcher or other groups, it's a trial and error, and it's a process, and it takes time to figure it out. And here's an example: if you just put pressure sore in Nursing Home Inspect, 2,318 reports will come up, or at least about a year ago it would come up, and that's massive amount of data for a study in and of itself. However, you might miss other investigations if you were to use bed sore, pressure ulcer, stage 3, stage 4, uh, decubitus, and other terms. And if you do use all the terms, then you're going to have over 15,000 total results. So big difference there. Here's an example from our social media abuse project. So sometimes surveyors don't even detail the specific platform, the social media platform. So you have to put social media, and you want to do it with quotation marks, and that will capture those. Otherwise, you want to put Snapchat, but you see the highlighted yellow there, Snap space chat, because guess what? Some surveyors write it that way, and it may not pick it up if they write it this way, if you write it Snapchat in one string. So you want to write TikTok, Facebook, X, or Twitter, Instagram, etc. But you also want to write photo, picture, video, audio, mobile, cell phone, camera. So you get the idea. You need to know the keywords of the substantive issue that you're interested in. And my advice is to think about how surveyors may phrase an issue. And the more you read those investigations, as I've done thousands of them over the years, it takes time to figure it out. Keep refining your search. It is a process. And consult with experts and researchers who studied a particular issue, because they can advise you on what keywords you should use. Now, you need to be mindful of the fact that a keyword, if a keyword that you used appears in an investigation report, doesn't necessarily mean that a citation or F tag was issued for the issue represented by the keyword. And so there's footwork to do. You still need to go through the investigation report and see whether that keyword that came up is part of the issuance of a citation, or it's completely unrelated. For example, if you just put abuse, the word abuse, well, guess what? A lot of investigations include the nursing home abuse policy, so it will pick it up, but it doesn't necessarily mean that there was an F tag issued for abuse. I hope that's clear. And the same goes for the keyword retaliation, right? It could be a policy about prohibiting retaliation when residents express care concerns. Another caveat is when you search for a keyword, or the ProPublica tells us that the app only returns the number of deficiencies that match the search criteria, not the overall total number of deficiencies cited in each report. And so if you want to see the total count of deficiencies for a particular nursing home or a specific report, you can visit the nursing home's homepage on Nursing Home Inspect. And we're going to give an example of that later. Other search parameters and filters, date ranges. You can put, let's say you're interested in the first few months of the pandemic. So you can put, for example, February 2020 until, say, September 2020, or whatever the end point of time you want. Obviously, now we're phasing out of the 3-year cycles. So at this point, you may see the tail end of it. So you need to be mindful of that. But it's really great because you can really say, give me the last year only. However, there's lags in posting of investigations, so you need to take that into account as well. So you can also do search at the national level, at the state of interest. You can do a search at the county. Let's say you're a family member, you're interested in a particular county. You can zero on it because you want to be able to visit your loved one frequently. And it's not going to help you if it's going to be 300 miles away because you can't visit your loved one. Unfortunately, the radius search is not possible at this point, but I think it might be on the radar screen of ProPublica, and they may be considering including it in the future. So you can really zero in on the radius, geographical radius of your interest. It can also include deficiency seriousness and scope severity of the citation that was issued for a particular violation of the federal nursing regulations, whether it's DEF, and we're going to go through it in a minute, is potential for more than minimal harm. And then GHI is a higher level of scope severity, which is actual harm. And JKL, which is immediate jeopardy. But I will highlight that there's a lot of harm in the DEF level for different reasons that we can discuss. You can also filter it. I want only annual inspections, or I want complaint investigations only, or only infection control. Maybe you're a researcher interested in infection control. But you could also do all of them at once. And you can also filter it by deficiency categories, or it's also called regulatory groups. And I'm going to explain what it means in a minute. So again, you can search within a county of interest. Let's say Beltrami County in northern Minnesota will retrieve 4 nursing homes. And then there's a drop-down menu, and you can sort them, those 4 nursing homes, by lowest or highest deficiency count, or lowest or highest count of serious deficiencies, and also for fines and nurse turnover. So there's filters that you can further enhance your search within those 4 nursing homes within your county. Other types of information on Nursing Home Inspect ProPublica website. You can see whether it's a for-profit entity or not for-profit. That's important because research studies have shown repeatedly that not-for-profit nursing homes have better quality outcome across the board, and for-profit have more violations of federal regulations, etc. There are exceptions, but that's pretty much a very solid trend. You can also find information about nurse staffing levels, turnover rates, and you can read the recent Care Voices, actually Consumer Voice, should be Consumer Voice fact sheet about the very important turnover rates, which is an indicator of quality of care. And there's a very high turnover rate in the nursing home industry at all levels of care, not only nurse aides and CNAs, but also nurses and administrators. And the instability of the care system is an indicator of care. You can also see information about delayed investigation, which is the most recent standard inspection occur if the most recent standard inspection occurred more than 2 years ago. Inspections are supposed to occur every 9 to 15 months, average a year within a state. So it's going to flag that out too, very important. And it's a major issue nationwide for state survey agencies that struggle to fulfill their mission and quickly conduct investigations on site. And many have backlogs as well of investigations. It also will show you fines information and payment suspensions, but you have to be aware that nursing homes often use the appeals process that may mask fines. So the picture may not be complete. You can also see a fascinating data element of change in ownership flag if the ownership of the nursing home changed over the past 12 months. Again, that's indicator of instability, but this could be a positive thing if it's a good ownership that are dedicated to person-directed care, as opposed to a ownership that is focusing on the bottom line, as opposed on human beings' dignity and safety. Information of plans of correction, although the government reporting there is a plan of correction in nursing homes, and that's where the nursing home is instructed to fix the problems, and then there's some follow-through, not always of high quality, but there is a follow-through by surveyors to see that they actually fix the problems, because otherwise, what's the point? It can happen again. That's a big problem also in the assisted living sector. But these plans of corrections can be viewed at the nursing home or by submitting a Freedom of Information request to the government. And here you have the worst of the worst, is what is called CMS Special Focus Facility Program. These are nursing homes with a history of serious quality issues. There are more problems, more serious problems, and a pattern of serious problems persisting over a long period of time. So you have special focus facilities, but you also have special focus facility candidates, and I'll give a definition in a second. And I included the latest list of those nationwide, including in Minnesota. The latest one is from November 2024, where you can find those completely avoid nursing homes in your state across the country. But you have to remember what is called the yo-yo compliance history, when some of them graduate, but then you come back 6 months later and they're back into the SFF program because they're corrected it only temporarily. And here we have an example, again, as of November 2024, of a special focus facility in Minnesota, and I'll show it later in the website. Victory Health and Rehabilitation Center in Minneapolis, Minnesota, has 56 total deficiencies, which is alarming. You can access the PDFs of the investigations over the past 3 annual inspection cycles, and each cycle is roughly 12 to 18 months. And you can also, for each investigation, you can see the breakdown. You can quickly see the breakdown of scope severity determination for each FTAG, and you can see if one of them is of interest, one of those violations is of special interest to you. There's information about penalties, total fines, payment suspensions, as I mentioned earlier, nurse staffing, nurse turnover information, with a comparison to the state average, and also bed capacity, and also information about owner or managing employees, and when they started their position, because everything starts at the top and trickles down to the director staff. So ownership information needs to be expanded on Nursing Home Care Compare, and then it's going to be available on Nursing Home Inspect as well. Here's another special focus facility in Minnesota that I identified this morning. It's called the Terrace at Crystal LLC in Crystal, Minnesota. And if you thought that over 50 deficiencies is bad, 158 total deficiencies. So this makes me want to pick up the phone and call the Star Tribune, but I'll leave that to Chris to consider. Total fines over $430,000 of fines and 5 payment suspensions for this, frankly, worthless service, warehouse, terrible care place that no one should live in. And it's very alarming that this place still exists. But we have to be aware of the potential trauma of residents who might need to be moved upon closure, and it needs to be extremely cautiously and be trauma informed, and should be done in a professional way and enough time to allow this to happen safely. And here is an example of 10 SFFs in Minnesota, and the definition of SFF candidates is that those nursing homes meet the criteria to be as SFF, but it hasn't been yet designated as one. 10 of them in Minnesota. As of November 2024, you see their names and their locations. So also red flags for families to avoid. Well, by the way, you can do a study on special focus facilities within a state, within a region, or across the country. That's a topic for a study right there. But make sure to save those PDFs, because they could also disappear if they close, for example, earlier than the 3-year cycle. So you can also find information about inspections delayed, as I provided the definition a minute ago. Some nursing homes have not been inspected recently. If your home has not had a standard inspection in more than 2 years, it will have an inspection delayed flag at the top of its page. This means that the nursing home without a recent report may have undiscovered issues. Well, they could have undiscovered issues even if the state survey agency comes every year, because there's GAO report that show that surveyors often miss significant issues, including abuse, during their annual surveys. And one of the big elephant in the room is that many state survey agencies are financially starved, and they have major issues with manpower, lack of surveyors, turnover of surveyors, a lot of surveyors left during the pandemic. And it's not surprising that a lot of them have backlogs and delayed investigations. And this major report to the U.S. Senate Special Committee on Aging demonstrated that problem in many states and the harm to residents, because problems that are not addressed could escalate and become more severe, and residents suffer and families are suffering, and the state survey agency does not fulfill their mission to protect vulnerable adults. So before going into the demonstration, the demo of the Nursing Home Inspect website, I want to point out, when I mentioned earlier, there's regulatory groups, and then there's FTAGs. So when you look at those regulatory groups, and there's a series of them, they're highlighted here in gray. So you can see on the upper left side, there's a regulatory group for resident rights. Okay, and then there's a regulatory group for abuse, neglect, and exploitation. The residents have a right to be free from them. Then there's a regulatory group for admission, transfer, and discharge. Another one about assessments, about care plans, quality of life, quality of care, physician services, nutritional services. And this is the second page. So you see how many regulatory groups and how many F tags under each regulatory group. There's a behavioral health regulatory groups, pharmacy services, laboratory, dental services, food and nutrition services, administration, quality assurance and performance improvement, infection control, physical environment, and training requirements. And now I'm going to zero in on one regulatory group of interest, the freedom from abuse, neglect, and exploitation. You can see the breakdown of the different F tags. So, for example, F600 is free from abuse and neglect. But you can have F607 that the nursing home failed to develop and implement abuse neglect policy, or F608 when they failed to report reasonable suspicion of a crime against a resident, or the F609 when they failed to report allegation of violation. So these are just examples to illustrate, because we can search for them, and I'll show you in a minute how powerful that is for the first time in the nursing home landscape. So when I talked about scope severity, this is what I mean. So every state survey deficiency citation that is issued for a violation of a federal nursing home regulation receives a deficiency citation, an F tag. And for every F tag, the surveyor is instructed by CMS to determine the scope and severity. And the severity is, as you see at the bottom, is the level of harm inflicted on the resident or the residents. And the scope is how many residents were harmed, how widespread the problem is. And I want you to overlook the ABC at the bottom. So the scope severity goes from A to L. And I want you to look from DEF, which is the lowest scope severity, practically the lowest, because we're overlooking the ABC for now. DEF is potential for more than minimum harm. GHI is actual harm. And at the top, it's JKL, is immediate jeopardy, which is the most serious one. You see the definitions on the left-hand side. But I have to highlight that for example, in Minnesota, roughly 95% of the citations in nursing home for abuse and neglect are in the DEF level. And trust me, there's a lot of harm to residents, even at the DEF level. And that's a big problem that we can talk more about. But I wanted just to give you a picture of what did I mean by scope severity determination. So those letters are very important to remember where a surveyor issues a citation. Now, when we talk about harm, people, as I mentioned a minute ago, people living in nursing homes can experience a lot of harm, even in scope severity DEF, which is potential for more than minimal harm. In my opinion, it really devalues and dismisses their experience, as I will demonstrate in a minute. And distinction, and one of the reasons there's a distinction between the actual harm, say broken bones because of neglect or abuse, and the surveyor's ability to demonstrate that the violation of federal regulations contributed to it. So if they come 6 months later for an abuse allegation or neglect allegation, it may be very hard to collect sufficient evidence to substantiate it. And so they may just issue it at a lower severity level because there's a staff turnover, because a resident died, a roommate died, or they moved to another care setting. And there's a lot of problems with delayed SSA investigations and the problem of understatement. And that's been documented for many years, where some surveyors issue a citation at the scope severity level that is lower than it should be. How do we know? CMS sometimes doing comparative surveys, and they demonstrate that. And the Long-Term Care Community Coalition, in collaboration with the Center for Medicare Advocacy, have what is called the Elder Justice No Harm, in quotation marks, newsletter. And very frequently, they put out those newsletters, and they show how when state survey determined it as no harm citation, scope severity, there's a lot of harm. And I didn't even mention psychological suffering. So we need to be informed about that. And here, really, before we're going to do the walk through the nursing home inspect, I want to just show you the major components of CMS form 2567, which is also called, you can see on the upper left-hand side, Statement of Deficiencies and Plan of Correction. That's a very, very important document. When I referred to PDF earlier, that is what I mean. And it could be 3-page long, and it could be 70 or 100-page long. And this is the summary that the surveyors writes up. It's a narrative, it's text-based. And on it, they describe the failure. You see there in the middle part, based on observation and interview, this nursing home failed to XYZ, okay? And then findings include, they show the evidence that they used to substantiate the violation. And you can see at the top when the investigation was completed, the date, the address of the nursing home, the name of the nursing home, the F tag on the left-hand side, and the level of harm. So I wanted to make sure you understand when we talk about that form, what it contains. And it's text-based, but you can search within it using Control F to search information of the interest. But you should be mindful of the fact that oftentimes there are multiple F tags in a single investigation report, and some of them may not be of interest to your area of interest. If you're, for example, a researcher focusing, for example, on fear of retaliation, for example. So you have to be mindful of that. You have to sift through. There's still footwork to do to find the areas of interest to you. So at this point, I would like to start, unless Chris has comments or questions at this point, or observations, I would like to give you a demo of the Nursing Home Inspect ProPublica website and how you can use it and really harness the power of this website, whether you're a family member, a potential resident, or a researcher, care advocacy organization, a media reporter, and other groups. So to do that, I will stop sharing my screen. And Chris, do you have any general comment, observation, question at this point before we go into the walkthrough of the website?
Sorry. Go ahead, Elon.
Okay, a little bit of pause here. I know I'm speaking quickly, and I apologize for that. And Chris, before we continue, would you be able to tell me roughly how much time we have? I want to make sure that I'm not going to use all the time, but I want to know that I have at least 15 minutes or 20 minutes to.
Yeah, we've got 25 minutes.
Thank you so much. That's reassuring. Okay, so now I'm going to share the screen again. Okay, I'm going to have to move out a couple of windows here. Okay, so it won't block my view of the screen. Okay, so this is the Nursing Home Inspect ProPublica website that I spoke about earlier. Excuse me. And this is the landing page, okay? This is where you can find investigation reports across the country, a particular state, a particular county. The search bar that you see here is for the general search. Later on, do you see the cursor? Yeah, if you can see it on the right-hand side, it's the advanced report search. We're going to get to it in a minute. But before we do, I want to show you the information you can already find on the landing page. You can see breakdown by states, state-by-state breakdown of serious deficiencies, okay, causing immediate jeopardy, the highest severity one, as we described earlier, by state. So you can see that Minnesota is fourth there, okay? But again, we have to be mindful that we're not supposed to compare between states, but I would say at the crude level, it gives you some indication that your state may not be doing well, and you need to improve oversight, accountability, enforcement there. You could also see average fines by state and delayed inspections by state. That's an important indicator as well. If you, so for example, a care advocacy organization that want to go to the capital of your state and advocate for improved funding for your state survey agency or your health department. You could also see serious deficiencies by home nationwide. You can see highest fines by home nationwide, and you can see the fines. You can see here those definitions of special focus facility or special focus facility candidate, delayed inspections, the definitions. You can look if say, let's say I'm a reporter and I'm interested in the most recent deficiencies nationwide. Okay, they're going to come up right here, and you can click here, see more. I hope you can see my cursor to see more of the whole list. And you can see this is the letters I mentioned. Remember A to L, scope severity? You can quickly go to the most severe one if you want. And then you can click on the nursing home itself and find the information there. This is the grid that I showed you earlier in a different format, the scope severity. And then you can go to your state of interest. Let's say you're in Minnesota. So you'll click on this one, and it will show you the breakdown within Minnesota. Okay, let's go into it for a second. You can see that Minnesota has 340 total nursing homes. You see the total over $8.5 million in penalties, 102 payment suspensions, nursing home with serious number of homes with serious deficiencies, number of homes with infection-related deficiencies. You can see the most recent serious deficiencies in Minnesota. Let's say you're a Star Tribune reporter. You can go specifically to the most recent serious deficiencies and look them up and see what's going on lately. And then you can see alphabetically ordered all those nursing homes. And for each one of them, you can see the address, total number of deficiencies, number of serious deficiencies, total number of fines. And you can sort the homes by, because we have so many hundreds of them, you can sort it out by highest count of deficiency count or highest count of serious deficiencies count, okay? You can sort it out by highest total fines. You can sort out by highest nurse turnover. So it's really powerful tool. You can see all the nursing homes in Minnesota. I'm going to go back to the landing page. And let's say I live in northern Minnesota. In the county, you can put the nursing home name if you know it. You can put a keyword of interest, but you can put a state or a county. See here the drop-down menu? And let's say I live in, I hope I pronounced it correctly, Beltrami County in Minnesota. So look what's happening now. B, E, it already starts to populate Beltrami. You see what happens? It already populates Beltrami County in Minnesota. It detects it in the database. And I'm going to click on it, and immediately I get, as of November 2024, remember there's a gap. Somebody could have died of neglect in later in the last 2 months, and it will not be on the website. So you need to be mindful of that as well. So in this county in Minnesota, there's 4 nursing homes. You can see the total number of penalties, number of homes with serious deficiencies, suspensions of payments, and deficiencies related to infection. You can see those 4 here, but again, you can sort them out. Let's say now I quickly want to, the hospital discharge person said, you have 12 hours, you need to move your loved one out of the hospital to a nursing home, and you quickly want to know which one has the highest deficiency count or the highest serious deficiency count. Let's say I'm going to click on it now. So it switched the order, and now I can see that this one has 45 total deficiencies. So you want to be, as opposed to the last one has only 1 deficiency. So that's clearly better than the first one, and 3 serious deficiencies in the first one. The fines, and look at this, 55.6% nurse turnover. That means that you come back within a year and half the nurses are not there. Talk about instability of a nursing home. Very powerful. Now, I'm going to go back now to here, and I'm going to, so you can put, for example, you see the word choke here, they're giving examples. I gave it earlier. So if you put the word choke, let's say I'm a researcher interested in choking, and I'm not going to put quotation marks because I want all variations of the word. If I put quotation marks, I'm only going to retrieve the choke one. And look at this. So for some reason, this is not working well, but I'm going to show you how the more powerful search tool does work. hopefully. And so when we get to the advanced reports, that's the most important one for particular purposes, such as if you're a researcher and you want to quickly compile all investigation reports across the country or a certain region. CMS divides the country to 10 regions. Maybe you want only the 5 or 6 states in your region, and you want to focus on a particular phenomenon there. So this is the advanced search, and you have the tip sheet that I put in one of the first slides on the presentation, how to become a savvy person who searches for those investigations. So let's say I'm going to put the word rape, okay? And I want to specify, I don't want to specify the location. I could do it by state, but I don't want to do it at this point. And so I'm going to choose, I want it to be a complaint investigation. I don't want to specify the time. That will take all three, that would mean that it will capture all three annual cycles of inspection. And I don't want to specify the scope severity at this point. I could do that. And I want to go directly. Remember the regulatory groups? These are the regulatory groups. And each, we're going to get to it in a minute, but each one in them, they see the F tags in them. But right now, I want to click on all abuse and neglect and exploitation regulatory groups for my search. Okay, so I'm interested in rape and understanding how to prevent rape. So I'm going to put rape, no dates, or if you want dates over the past year, for example, or 2 years. At this point, I'm not going to put severity. I'm going to choose the regulatory group, and look what happens now. I press submit and see how many reports are coming up. 214 reports with the word rape. Doesn't mean that the citation was, the violation was specifically for rape. You still need to do the footwork. And now, look at this. So I'm getting this nursing home in Illinois, okay, the first one. And I see the PDF link here. And I remember the summaries, the brief summaries that I mentioned earlier. So you can see here, he tried to rape me and he tried to put his hands in me. We're going to get into that in a second. And so you can also sort those deficiencies by most recent reports as well, okay, and other filters there. And so we're going to go into that now that you know what how investigation report looks like. And then so this person, this victim, R1, they're not going to, these are de-identified, so they call the resident R1. And I want to just highlight, so this here. So I'm highlighting that part in the report, okay? And you can see that the resident who lives with a moderate cognitive impairment, because that was stated earlier, was lying in bed. The resident stated, I've been sexually abused here. A little short guy, V4, which is actually a registered nurse who runs the place, he tried to abuse me sexually. I don't want anything to do with him. He is a short guy with a long ponytail. The resident then began to get tears in her eyes and stated, I have been upset and no one will listen to me. I can't sleep. He is in and out all the time. He tried to rape me and he tried to put his hands in me. I kicked him off me and he tried to sexually rape me. His name is de-identified, V4, which I saw earlier, that is a registered nurse, but I don't know him. It happened in my room. And you can read more detail. Now, I'm going to go back now so you can see the level of detail that now is possible to access if you're a researcher or if you're a family member. Very quickly, very powerful. Again, remember Professor Pam Tister, who for a long period of time had to pass a law in her state to be able to access sexual abuse investigations against that were conducted by APS workers in her state. So very, very powerful. Okay, I'm going to go back now and show you how in the regulatory group, abuse and neglect, I would like you to mostly overlook the series of the 200 F tags because they are from the before the change in nursing home regulation that was phased in. It was in three phases between 2016 and 2019. The more recent ones, the new ones are the F600 ones under the abuse and neglect. And so you can specify, I want, as a researcher, I want only the abuse ones, or I want only the 607 ones, or a combination of these. I want all of these. Develop and implement policies and procedures to prevent abuse, or um, failures related to suspicion, to reporting a suspicion of a crime against a resident, or if 609, failure to timely report suspected abuse, neglect, or theft, or 6010, failure to respond appropriately to all alleged violations. So you can do a search by that. So it show you the resolution that you can do with that, okay? And again, you can look at many other types of F tags of interest. Let's say you're a researcher interested in nutrition and dietary services, okay? Like the Rudd Center at University of Connecticut here in Minnesota, I'm sorry, here in Connecticut, and you can look at those F tags of interest because we know that food is a central part of the life of residents. And so what are the violations there? Are they getting a nutritious meal? Are they meeting allergy requirements and special diets, etc.? You can go into the resident rights deficiencies and honor residents' rights to be free from reprisal, which is retaliation. And you can go into respect and respectful care, etc. And there's other regulatory groups around quality of life, as I mentioned, infection control, etc. In the quality of life one, for example, there are F tags that have to do with our qualified persons providing care to me. Do they honor my preferences and choices and values and beliefs? Do they provide appropriate pressure ulcer care, which is a major source of neglect? There's F689 is accident hazards, where a lot of different types of accidents violations are collapsed in one F tag. In the environment one, you can look at, I'm sorry, I'm going to collapse it back. In the environment one, you can look at issues that have to do with the call system, whether it's installed and working in the bathroom, for example. See the level of resolution. You can also see if there's failures related to inspecting bed frames, mattresses, and bed rails, if any are used for safety. And we know that a lot of residents are severely injured and die, including in Minnesota, recent reports, when bed rails are not operated as instructed by the manufacturer and are not monitored routinely when changes occur with them. So again, it gives you a sense of the resolution. In the quality of life and care regulatory group, you can look into whether the nursing home ensures sufficient staff of competent staff with skills necessary to meet the needs. Whether with FTAG 741, even though sufficient staff is open to interpretation, it's a very problematic term, but we can talk about it separately. F744, whether appropriate treatment and services are provided to residents with dementia. We know a majority of residents have dementia in nursing homes. And these are just examples. So I want to go back before wrapping up the demo here, and I want to give an example of, I'm going to put the name. Let's say somebody tells me, well, you should look into, or I live next to the terrace at Crystal. You see how it populates already? Halfway. And that I'm going into. Now look at this. Number one, I know it's for profit. So that's something to consider, as we alluded to earlier. Number two, it's a special focus facility. So that's a no-no. That's a big no-no, as we illustrated earlier. You can go from here, as I mentioned earlier, straight into the CMS Care Compare website. And there you can see the warning signs. You won't have a star rating because it's a special focus facility. So there's no rating, but you can see the inspections, the staffing, and the quality measures. Quality measures is mostly unuseful information in many cases because it's a self-report, as I mentioned. You can see vaccination rates, fire safety, penalties, number of certified beds, legal business name. You can see ownership detail. Look at the ownership detail, which is a start, but it's not enough for where we need to be with requirement of nursing home to provide this service. So you can see that it's a for-profit. You can see the name of the affiliated entity. Well, that one isn't. And you can see the name of the owner right here, okay? So that's a problematic owner already, and you should know if they have a chain, you should be worried about the other care settings oftentimes. So I just wanted to show you that it links to the Care Compare website. Now I'm going to go back out to the Nursing Home Inspect website. I just wanted to show you how you can do it here. And then you can see the staffing levels that are 2.5 for nurse hours per resident per day, which is much lower than the state average, okay? The recommended, based on a study many years ago, that needs to be updated, is 4.1, but you can see that it's much below that. So it's already a big problem because lack of staffing equals often neglect and abuse. You can see the 60% nurse turnover. You can see the instability in this system. And you can see 158 total deficiencies. That's extremely alarming. I mean, it's very, very disturbing that actually human beings live in this setting. It's very, very dangerous, okay? And this is true as of November 2024, I believe. As you can see here, always know what's the time point you're looking at, okay? And you can see the breakdown of all those investigations, okay? So you can read the full report here, if you can see the cursor, and you can read more. Let's say this is a standard report and you want to read more, you see the breakdown of what type of deficiencies. Now you know what FTAGs mean. So you can see the realms, those areas of violations. Look how many areas of violations, from abuse and assessment. So it's across the board. This place is toxic. And you can also see the scope severity letter here, the seriousness, okay? And you can click on the full report here. And I promise to wrap up in 1 or 2 minutes. Just want to show you the report in this horrible place. So you can see the name, you can see the identification number, the federal identification number. Every nursing home has that. The date it was completed, the investigation was completed, the location, the name, the F tags, and it goes for 78 pages. So you have dozens of F tags here. This is the name of the report that I mentioned earlier from CMS 2567. Also, when you make FOIA requests, that's the name of the report you want to ask. So, and you can see again, based on review or interview and document review, the facility failed to so and so. And then the findings include, okay, this is what the evidence the surveyors gathered to substantiate it. And it's all de-identified. See, de-identification of dates and names of residents, etc. But you can glean a lot of information from those reports. So I'm going to go back now to the main page of the Nursing Home Inspect landing page. And there's a lot more that you can explore and really use your imagination and be creative about it. It takes time, but it's a very powerful database. And so I'm going to stop sharing my screen now. And I hope this was useful for folks. If you have questions to me or to ProPublica, please go ahead and do that, as we are working to include more data elements in the nursing home inspect. Hopefully ProPublica will decide to do it. And as Chris can speak about Elder Care IQ, as Elder Care IQ leadership are considering to add other data elements and perhaps hopefully expand to other states. So thank you for being with us today. I hope it was useful, and we continue the dialogue now and after this presentation. Feel free to reach out to my email and to Chris as well.
Dr. Caspi, can you give them your email address?
Yeah, it's on the first page of the slide, and I'm going to say it. It's my name in one string. So it will be Eilon Caspi, EILON CASPI, S as Sam, P as Paul, I, in one string, eiloncaspi@gmail.com. And it's again, it's also on the opening slide of this presentation. Feel free to reach out so we can work collectively to improve transparency, which again is the foundation for accountability. Thank you.
Thank you very much. And I would like to just let everybody know how very important this is. We launched Elder Care IQ a little over 2 years ago. We've already had over 10,000 people use this resource in just 2 short years. We will continue to improve, but we're careful in the data sources that we include because we want this to be as reliable as possible. And, we have no bias in this. We're a nonprofit organization. We offer this tool free, and we're hopeful that we'll be able to uh, start offering elder care IQ into other states. And I look forward to that. And again, the website is eldercareiq.org. And thank you with that. And thank you, Dr. Caspi.
Thank you, Chris, for hosting it and getting the word out about this database. And again, folks, feel free to reach out if you have questions or concerns or suggestions for improvement. And we appreciate you joining us today. I don't know, Chris, if you have any final kind of comments or observations. And if not,
No, I think that completes our session today. Thank you again.
right.